and action potential. Now hope you guys know what is action potential, what is resting membrane potential. Okay, so basically I have shown you over here, this is for the general muscle scale, and this is for cardiac myocyte. This over here, this is for cardiac myocyte. So let me just use some this thing over here. Okay, so this over here, it is for cardiac myocyte, and this one over here, this is for our usual skeletal and smooth muscle cell. So what does it say? What does it say? It starts like this. This is your -70. -70 is your resting membrane potential. Okay, means cell is at rest. Nothing is going on. Now a signal is coming to the cell. Maybe it may be some stimuli, maybe pain, noxious stimuli, or pain or vibration or anything. Okay, so depending on the type of cell, it can be, if it is neuronal cell, then there will be pain or that stimuli. If it is muscular cell, then because of neuro tissue, they will tell the muscle to act. Okay, if something is biting me over here, I'll definitely try to catch it. So this muscular contraction also need action potential. So action potential is everywhere, starting from your nerves to your muscles to your heart to each and every cells of your body, right? So look over here at the -70, what is going to happen? First of all, sodium channels are getting open. So this first phase over here in green, they are saying that sodium channels are getting open. Now sodium, I told you, sodium is more extracellularly, less intracellularly. Sodium will be influx, and that will lead to increase in the potential. So see, it is going towards the positive side. This process itself we call as depolarization. Now if someone asks me that depolarization in skeletal muscle cell or smooth muscle cell or neuronal tissue is mediated by, what will be your answer? It is mediated by sodium channel. See, it will not be same in all cells. If it is a SA node, it will be different. There will be funny channel, IF funny channel, that is the sodium channels only. With that, some calcium ion also plays major role during the depolarization. Okay, so calcium dependent depolarization classically seen in SA node, whereas we are talking about smooth muscle and skeletal muscle, and now tissue particularly, it will be sodium channel. All right, so now once this sodium channel has been opened and cell is getting inside, see, this is the cell. I am drawing my very bad shaped cell over here. Lot many sodium is coming inside the cell. What is going to happen? Cell will be completely positively charged. Yes, now inside everything is positive. After that, what will be happen? There will be voltage sensitive, voltage gated and voltage sensitive potassium channel. So what did I tell you? Potassium, cell is a bag of potassium. There is lot many potassium also, and lot many sodium also. Now if there is a channel, that is the potassium channel, voltage gated, and that is getting opening on up at a certain amount of voltage. For example, at 30 millivolt voltage, this particular channel is getting opened up. What is going to happen? All the potassium ion that is inside the cell will go outside, isn't it? Because of its concentration gradient, right? So potassium ion efflux will be there, that will lead to repolarization. So simple question, depolarization is basically sodium dependent, whereas repolarization is basically potassium channel dependent. All right, so this is the time, that is the action potential duration. This is called as APD, action potential the duration. Now let me be very clear with here. This is totally this is for cardiac myocyte. Okay, this is for cardiac myocyte. Now see here, they have given some phase. Okay, now what is the, I will not name the phase directly, I will just tell you. See, first of all, resting membrane potential is completely different. Here it was -70, whereas here it is -85. So first question, what is the resting membrane potential for cardiac myocyte? It is little bit more negative, -90. Okay, you can say -85 or -90. Okay, now what is going to happen? Phase 0 is called as depolarization phase. So same, sodium channels are opening. Sodium is more outside the cell, so it will try to come inside the cardiac side. So it is trying to come inside. Sodium is coming in. So what is going to happen? The membrane potential from -85, it has reached to somewhere around 0. Okay, even more than that. Maybe you can say +10. Okay, +10, till that level it has gone. Okay, now at this particular point, there will be initiation of phase 1. That is the initiation of repolarization. Now what is going to happen? Those sodium channel which were open will now close, and new channel, that is the potassium channel. Okay, now at this particular point, voltage gated potassium channel will open. So what is going to happen? Will potassium shift outside, or potassium will come from out to in? Can anyone tell me? Potassium should go outside, definitely, because of the concentration gradient. Right? Cell, I again tell you, cell is a bag of potassium. There are lot many potassium ions like this sitting inside the cell. Okay, and if I open the channel, if I put a leaky channel like voltage gated channel like this over here of potassium, if this is the channel, what is going to happen? Outside very less potassium, inside too much potassium, potassium will go outside. So cell is losing positive ions, right? Cell is losing positive ions. That will lead to somewhat that the membrane potential that was plus 10 or something like that, it will become little bit towards zero. Okay, it will almost become zero. So look over here, it has become zero. So this particular phase is called as phase 1, and it is the initial repolarization. So now what we had expected something like this, that it would continually go on, but it doesn't happen. It doesn't happen. Why it doesn't happen? See, it happens like this. It is going from here to, it had gone down, but like share market is going again up and then gradually again down. Okay, so what is the reason for that? So let me tell you the reason. This particular phase is called as plateau. Okay, you guys know it. What is plateau? Plateau is like flat plane. What is happening right now? So let me be very clear. Here at this particular moment, potassium is already going outside. This was going outside. Okay, but with that something is coming in. So let me do some potassium. I am throwing potassium outside. This arrow is showing potassium is going out of the cell because of the same mechanism, because of the concentration. But with that, there is another important ion, that is calcium. Now what is happening? Calcium is coming in. Okay, so because of that, positive is coming in, positive is going out, positive is coming in, positive is going out. So it becomes plateau. So this particular phase of repolarization is called as plateau. Now this is very important. First of all, mechanism is because of K plus efflux and calcium influx. So remember, calcium is coming in, potassium is going out. All right, now at certain particular point, the point is over here. At this point, now calcium gets exhausted. Now no more further calcium should come in. Okay, some may ask, sir, why did you send the calcium inside the cell? My dear friend, we need contraction. For that we need calcium and calmodulin to interact, and that will ultimately lead to contraction. So for this particular reason, calcium has come in. So this is phase 2. Finally phase 3, that is the rapid repolarization phase. That will be also because of what? Calcium channel will close and potassium channel are already open only. So positive ion is going continuously outside the cell. Okay, and finally what is happening at phase 4? Too much of potassium has gone out. So now we were expecting to be at somewhere around -70 to -90, but it can even go sometimes beneath that. That is called as hyper repolarization. Okay, hyper repolarization can be there sometimes. Okay, so this is what important. This is what is important. Just look over here, guys. These are the question. Phase 0, it is the rapid depolarization mediated by sodium influx. Phase 1, it is the initial rapid. Please remember, initial rapid from +30 to -10 due to inactivation of sodium channel. Okay, and with that I should write over here what? Potassium channel are getting open. Okay, good. Then phase 2, it is a plateau because of two things. Plateau is always because of two things. One is the calcium influx, and with that I should add one is the potassium outflux. Okay, fine. Okay, phase 3, it is a rapid fall in membrane, that is from -9 towards -90. It is basically because of potassium efflux. And phase 4 is polarized state, that is the hyperpolarization, sometimes we may say. Right, so see, there has been questions in the past. What is the resting membrane potassium of cardiac myocyte? What is the phase 1 called as? Which ion is responsible in phase 3? Which ion is responsible in phase 4? Lot many questions has been asked before. So this was high yield topic, so I have explained you in detail.